Hi everyone, Dr. Chris here. We're going to review how to set up for a surgical procedure. The room has been already set up, and the scenario is we are placing implants using a piezo instrumentation, and also we're drawing blood for utilization of sticky bone and CGF. So as you see in this room, everything is clean and sterile, and we're good to go. Unlike other procedures, because we have a lot of equipment that require on the doctor's side, we're going to have patient enter from the assistant side here. So it's important for us to have a clear path for our patients to walk to. Ideally, we would be moving this chair so it's not in the way. We have patient's x-ray displayed on this room, and if you see, we only have materials that we're going to be using for that day with least amount of clutter as possible. So first, we have a full setup for a blood draw phlebotomy kit right here. It's displayed on this phlebotomy kit, and most often we will be utilizing one white tube with 3 red tubes. In here, you'll notice we have a tourniquet available, alcohol prep pad, vacuum tube case, bandage, and a butterfly needle. And all of these are also displayed underneath this setup tray here. When we draw blood, it's important for us to recognize patient's comfort. So we also have this arm rest available here, sitting on top of a paper tray. Right next to it, we have cameras and the mirrors available for us to document each case. We have Columbia retractor here. We have a buccal mirror as well as a occlusal mirror. And we have this DSLR camera with a ring flash readily available for us to use. Before, we should always check to make sure the battery is on and charged so we don't have to go retrieve them during the procedure. Here we have a implant motor as well as piezo motor setup. These are hooked up to one extension cable, so that way we're able to move these devices on the cart without having to worry about cords being tangled. And the pedal is situated here such where that doctor, or myself in this case, am able to use these pedals readily during the procedure. It's important that for implant motors here, this is connected properly without significant tug, so that way this cord is not damaged. Everything is nicely plugged, the power buttons in the back ready to be utilized. What is not set up today is the saline and the tubing, but it's important that once saline and tubing is installed, we run the water for at least 10 seconds to confirm that water is running and good to go. Next is the piezo setup. Similarly, we want to make sure that everything is nice and sterile, and once the saline bag is attached, we run it for at least 10 to 20 seconds to confirm that water is running and it is flushing out the line before use. Here we have our implant kit available. This one in particular is a AnyRidge system kit. We have 2 kits available, but today we have AnyRidge setup ready to go. This is what our typical setup looks like. You can see that it's free of everything. The tray metal cart is nicely covered using the sterilized blue, and we want to make sure that it does look presentable and our patients don't think that, we just opened it up and it's messy. We have syringes ready to go here with the topical. It's important to get the Stella Life spray as well as Stella Life gel on the side ready to go. All of our surgical patients will rinse their mouth with a Carry-Free Pro Rinse prior to use. And we have extra cup of saline with the Monoject syringe ready to go as well. Moving on, we have this tube holders after we do a blood draw. This is to store the tubes in a vertical format before we utilize them. extra sterilized 4x4 gauze and 2x2 gauze. This is a syringe for us to pull the growth factors from the red tubes down the road. And we have our suture materials, our collar plug, and bone ready to go too. Our goal is to make sure that we do the procedure fastest, efficient way possible without having to leave the room. As for this drill kit and this instrumentation, we'll review that in a separate video. And lastly, we want to make sure that we have appropriate suctions ready to go as well.